Ian Harper, and hopefully we are expecting Professor Tony Costello to join as well. So we are here because we, in one way or the other, are concerned about Nepal, about the sort of alarming situation there, and we have familial or professional or otherwise connections to Nepal, and the sort of statistics that we have been observing are no longer sort of abstract statistics on infection rate or hospitalization or death. I think we are finding some of our familiar faces are amongst them as well. So we decided to organize this particular event for two different sort of objectives, I guess. The first being that we want to raise a profile of Nepal's situation. That's one. And the second one is we think that we need to think collectively about what needs to be done and what can be done given the sort of alarming situation out there. We know that the second wave of COVID-19 has really made the situation in South Asia quite concerning. India has received quite a lot of global attention. We think that given the open border between Nepal and India, about 900 kilometer long border with familial, religious, and economic sort of connections between India and Nepal, we ought to have this conversation and think about what we can do as those who are witnessing this, those who are experiencing this from within Nepal as well as from abroad. So without further delay, I am going to request Professor Sharad Onta, who is with us here, will speak for about 10 minutes, giving a sort of an overview of the spread of COVID-19 from epidemiological sort of perspective, as well as comment on capacity of the Nepalese health system to cope with the evolving crisis there. And then after that, Sir Jeremy Farrar will join us in about 10 minutes, and I'll let him in as well. Dr. Onta.
Yes. Okay, thank you very much, Dr. Jivan. Namaste, everybody. It's good afternoon here in Nepal and good morning to you all. Well, I think you all know that Nepal is now experiencing the second wave of COVID pandemic, which started in early April. I think before I just talk about the current situation, I think it is very important to make some comparison. It's not in terms of very conventional epidemiological term, epidemiological, using the epidemiological indicators, but I'll just try to make some comparison with the first wave. That will provide a picture that how the current situation looks like. I think that the first case started in Nepal back in the end of January 2020. It was almost the first case in South Asia. So, but it took a long time to take the pace of transmission in the country. So, what I feel is it will be better to categorize the two different waves. The first wave from the end of January to the mid-April 2021 or mid-March 2021, and then the 2 weeks time from mid-March 2021 to beginning of April was a very, very stable time period. And from the beginning of April, then we started again insurgence of new cases that we consider as the starting of the second wave. Therefore, the first wave from January 23rd to the mid-March 2021, there were total cases of 275,000 in the country. 275,000 total cases, total positive cases. And from April to date to yesterday, 11th May, more 135,000 cases are added. It means we had 275,000 cases from January 23rd to 2020 to the mid-March of 2021, and in very few days, about 5-6 weeks, we have added 135,000 cases, new cases, and it also very much compatible to death, the mortality. Like in the first wave, there were total 3,000 deaths. I mean, plus minus few deaths, but there were 3,000 deaths in the first wave. But in the second wave, from April to date, there are about 1,000 case deaths are added. It means this is a huge addition of the mortality. And if we compare the active cases in the first and second wave, in the first wave, the maximum number of active cases was in October, third week of October. It was about 46,000 cases in the first wave, the peak of the first wave. Now, we have about 98,000 active cases in the country. So it's more than double of the active cases compared to the first wave. And if we compare the the highest cases per day, again, it's very surprising that in the first wave, the highest case per day was 5,700 in third week of October. But now we have the highest case per day has reached 9,400. It's again the highest case is surprisingly increasing. And one more indicator I would like to compare, that in the first wave, we had the positivity rate of testing was nearly 30%, plus minus few percent. But now the positivity rate of testing has reached 44%. It means the 44% of the tests are being positive today. And this is the average positivity rate in the country. But if we look at the positivity rate in some of the regions, it is amazingly high. In some of the districts, in some of the places, the positivity rate is almost 80%. So it means 80% of the tests giving the result of positive. I think this is another very surprising fact. And now, if you just look at I just want to see some, the question is, what are the reason? What are the reason of the second phase? Is, as Dr. Jivan also mentioned, that one of the reasons, there are several reasons, but I would like to highlight just 2 reasons why we are facing the second wave of pandemic. The first reason is that, despite all our efforts to warn the government, to the state mechanism to be, alert of the possible second phase, but I think there was relaxation of safety measures, both at the level of citizen and at the level of the government. So it was almost, relaxed completely, and there was no public health safety measures followed by the citizens, and there was no such a program of the government to continue, to make the situation going suppressed. Therefore, we had plenty of opportunity to suppress this pandemic and, to stop, to prevent the second wave, but we failed there. And the citizen had somehow, the impression that we have overcome the situation and we have owned the, the pandemic, and the corona is no more a problem in the country. That mentality was truly very much damaging in terms of the insurgence of the second wave. And the second important determinant was insurgence of the wave in India, because soon after there was the decreasing trend of the cases in India and in Nepal. Again, a lot of Nepalese seasonal workers returned back to India for jobs, for works, and there were several 100,000 Nepalese were working in India after the pandemic, first wave of pandemic. And when there was insurgence of the cases in India, and they started coming back to the country, and there was no means of protection in the border. There was no means of screening, no means of quarantine, and the cases were, of course, there was free flow of infected cases to the country. And these two factors really contributed to the second wave of the pandemic in Nepal. And I think it's important to highlight some of the features of the second wave compared to the first wave. In addition to what I just mentioned, few epidemiological indicators, but I think more important is that there are three major features that we have noticed in the second phase. One is that the spread of transmission is much faster compared to the first wave, because in the first wave, it took about 8-9 months to reach the peak, but it was not the case in the second wave. It's much faster because the speed of the transmission is much faster this time compared to the first wave. That is first characteristics of this wave. And the second is, compared to the first wave, in the second wave, there are more symptomatic cases. Because in the first wave, even though there were a lot of active cases, but most of them were asymptomatic. And because many of them were asymptomatic, there was not so much pressure in the system because they were in home isolation, and they were not admitted in the hospitals. And that was also the reason that the mortality was much less in the first wave. But compared to the first wave, in the second wave, I think symptomatic cases are increasing. Therefore, this is not only the number, but also the proportion of symptomatic cases. There is plenty of pressure in the hospitals. Therefore, a lot of positive cases are admitted. And this is not only symptomatic, it is also reported that they are also more serious compared to the first wave. Therefore, the more
Dr. Onta, I'm sort of conscious of time. If you could conclude in a minute or so, yeah.
Sure. I'm now finishing that. The third characteristics is the younger people are being affected. These are three very important features that will make some difference in the management of cases. And I would just like to highlight in a few words that the pressure in the system is that first is now we have been, our diagnostic facilities have been inadequate, absolutely inadequate. We have not been able to test the necessary population. And the second is there is extreme pressure in the hospitals because we do not have adequate beds and we do not have adequate ICU beds for the serious patients. And we are suffering from inadequate number of ventilators, and also now in the last moment, I think there is extremely shortage of oxygen that is required for the hospital. I think these are a few pressure in the system. I think I will be sharing again. This is what I just wanted to say in the beginning. Thank you, Dr. Jivan.
Thank you, Dr. Onta, for that intervention. And there are a few questions to you, which we'll come back to. Just to the participants. Sure. I didn't mention that at the beginning. We will be, listening to all our panelists who will speak for about 5 to 10 minutes. And then at the end, we will take comments and questions, as well as, thinking much more forward, about what we can do as those who are concerned about what's happening in Nepal. We are now joined by Sir Jeremy Farrar, the director of the Wellcome Trust, who will go next, who will speak on issues around vaccine supply, as well as its distribution from a global perspective, and what can country like Nepal, what options a country like Nepal has, given the sort of alarming situation there. Jeremy, please.
Yeah, thanks very much for asking me to join. I haven't met all of you, so I look forward maybe at some future date to meeting all of you. Just a little bit of my own background. I spent 20 years living in Vietnam and worked for about 15 years, and still continue to work now actually with predominantly with Patan Hospital in Kathmandu, mostly actually historically on typhoid and tuberculosis, but my own background is actually more in emerging infectious diseases, and I became head of Wellcome 7 years ago now, but still do clinical work in Patan every year, or teaching and the rest of it. I'm a clinician and researcher. So just on the situation in Nepal is really frightening. In fact, it's beyond frightening, as we just heard in those opening comments, which I joined. It's very easy if you're sitting in Washington or London or anywhere else in those countries, and Europe increasingly, to think that the worst of the pandemic is over. We are still much closer to the start of this pandemic than the end. That's the awful truth. And I'm afraid in the British context, I use the word the arrogance of complacency. In other contexts, I'll be more forgiving, I think, and use the complacency of exceptionalism, I'm afraid. Without naming any countries, well, UK I can use as the example, thinking that for some reason the UK would not suffer in the same ways that other countries did. I'm afraid this is an infection, an animal infection, which has come across to humans. Humanity had no immunity. In most of the world, that immunity still is only at about 15%. So there's 85% of the world's population, approximately 80% of the world's population, who have never seen this virus. And therefore, with a natural R of 3, that means I would give it to 3 other people if I was infected. And clearly asymptomatic spread has been known since the 20th of January 2020, asymptomatic spread, and still infectious in some patients after a few weeks. So you're infectious for a very long time and spread predominantly by the respiratory route, for which a year ago we had no diagnostics, no treatment, and no vaccines, was always going to be difficult to control. But I'm afraid in many countries, political decision-making has led to the pandemic being worse than it had to be. And I'm afraid we're going to continue to see it reverberating around, frankly, until there is population immunity that is either derived from natural infection or, and this is the great tragedy of today, by making vaccines available in an equitable way around the world. If you go for natural immunity, you will have to have 80% of your population vaccinated, getting infected, and with a case fatality rate somewhere between 0.5 and 1%, that will lead to a horrific number of deaths. Herd immunity by natural infection is unethical as well as scientifically ridiculous. So vaccination is actually our only real exit strategy from this. And tragically, the world created the vaccines in 2020 because of some brilliant science, but is now refusing to equitably share those vaccines. And the reverberation we're seeing in India, and is now inevitably rippling out, I'm afraid, to Nepal, to the west, to Pakistan, to Afghanistan, to Iraq, and then into the Middle East, and to the east, to Bangladesh, Myanmar, the southern border of China, and into Southeast Asia. And because of the close links between South Asia and East Africa, we have already identified the so-called Indian variant in East Africa. So we're seeing a reverberation now in South Asia, and I think it will spread globally. We shouldn't blame the variants too much. It's sometimes, I think, political expediency to blame variants. Yes, the variants are more transmissible by about 20 or 30%, but the old virus was perfectly capable of causing these waves. And I'm afraid, I'm not talking about South Asia here, I'm talking about other countries. Other countries have tried to blame the variants unexpectedly, and somehow it was unavoidable. The old variant was perfectly capable of causing these waves in a non-immune population. So I'm afraid that we're now in a situation where we have to react, and that means providing the clinical care that we heard about in the first talk, oxygen, protection of healthcare workers, and as far as possible, restrict mixing of families and communities, because that is the only thing that we know works at the moment. Clinical care and public health measures, masks, hand washing, and restricting gatherings and mixing of households. That's extraordinarily difficult in any environment, but particularly in the environment of South Asia, of course. But the push that we need to all give is that, number one, and number two, to push all of our political colleagues, friends, and oppositions to make vaccines equitably available. It wouldn't make any difference to the UK or to the United States now to just slow down the vaccine rollout in their countries by a little bit and share the hundreds of millions of doses that are available. The United States will never use the AstraZeneca vaccine. I've had the AstraZeneca vaccine. I think the risk benefit is absolutely clear to a benefit. We need to push our political masters to sharing those vaccines equitably around the world. But sorry, make no mistake, vaccines will not get Nepal out of the problem today. They won't impact this wave of the epidemic. The impact of this wave of the epidemic, I'm afraid, has to be on trying to restrict mixing of people, clinical care, oxygen, protection of healthcare workers. It is traditional good medicine and good public health. The vaccines are critical in the medium term, but they won't get Nepal out of the current crisis, I'm afraid. Maybe I'll stop there, Jeevan.
Yeah, thank you, Jeremy. I'm aware that you have to leave in a few minutes. So if there is any burning question to Jeremy, if you don't mind, for a couple of minutes, we might.
Just on the testing strategy, it is very important. We have about a month ago now or so made quite a significant, in part of a sort of $40 or $50 million award on testing and sequencing of the virus, including in Kathmandu. So I hope that I know that is now being done. And I hope that to some extent helps, and an additional $10 or $20 million into oxygen supplies for South Asia.
That's great. Thank you so much. There is one question, Jeremy, in the chat box, which we might take advantage of you being here. What 3 steps for Nepal? So if you have to prioritize and say, I think you've made a very important point that vaccine is not a solution for this wave. What are the 3 things? I think you've already sort of talked about,
I think it is remembering public health works. Non-pharmacological interventions work, but they're really difficult to implement, particularly in some environments and some cultures, and we all appreciate that. But political messaging around restricting gatherings, trying to restrict mixing of households, that is the most important. The mixing of households, yes, and children and schools are a secondary consequence, but the public health measures, non-pharmacological, I think are the number 1. Number 2 is clinical care of those that are sick and protection of healthcare workers. And number 3 is the vaccination. I think it's in that sequence that's critical, that in the next 2 months, it'll be the first 2 of those that make the difference. In months 3 to 6, it'll be the vaccine.
That's very useful. Thank you so much. I'm mindful of time that we will now. Well, there is one question, Jeremy, to you. You trust the Chinese?
David, I do. The only thing to say and learn from the experience in Chile, the Chinese vaccine, actually, I do. Firstly, I trust, and I actually think it's an interesting vaccine because it's producing an immune response against the whole virus, not just the spike protein. In fact, if I had my choice, I'd have a Chinese vaccine followed by a boost of one of the other vaccines. The Chinese vaccines work, but learn from Chile, and that is the Chinese vaccine has very limited impact after its first dose, and not until you've had the second dose. And that's where Chile went wrong. They lifted the restrictions thinking there would be protection after the first dose, but they didn't get any protection. No, this is known until the second dose. So if you're going to use the Chinese vaccines, you don't get the immediate impact that you do with the other vaccines to some degree after the first dose. So you have to wait till the second dose until that boosting gives you the immune protection.
That's very helpful. I think good lesson for Nepal as well. That given that China, it seems, there are some news reports saying China is going to send further sort of a vaccine to Nepal. A very good, point there. So we'll be mindful of time. We need to move on. We'll take some of these questions later on. We will now go to Dr. Lhamo Sherpa, who will share insights from the situation on the ground, who works within an NGO in Nepal and has insights on not just from urban areas like Kathmandu, but also from rural areas. So Dr. Lhamo.
Yeah, can I speak with my video off, or do I need to turn on my video?
We would prefer to see you when you speak, if that's possible.
Okay. Yeah, thank you, Dr. Jeevan, and the organizing committee for organizing this webinar. I have written down the points, so I'm just going to read it through. As many of you may have already noticed, our health system's demand for services has exceeded its capacity to provide the services, as a result of which many hospitals, both private and public, have stopped the admission of COVID patients. And it's because of the lack of oxygen, lack of beds in ICU, medicines, and even lack of human resources. Since many doctors, nurses, ambulance drivers, caregivers, support staffs are working tirelessly, and some of them are even sick themselves. The number of cases in Nepal has been rising steadily, and if we compare those per million, instead of looking just at the crude numbers, then those are even higher than India. But still, we're only looking at those numbers that has been officially reported by the government of Nepal. We still believe that there are reasons, and there are reasons to believe that the situation might be worse. And we're not even seeing the full picture of the pandemic, and I'll tell you why. On 6th May 2021, the head of Nepal Public Health Laboratory said in a meeting with WHO, government, and donor agencies that there was a reduction in the number of people who were suspected to have been infected with the UK variant. But she was unable to state which variant was driving the surge, as they were still investigating. Something similar was also seen in the frequencies of sequence graphs shared online from India, where there was a reduction in B117 UK variant and an increase in B1617 variant from April. So B1617 variant has been declared a variant of concern by the World Health Organization due to its increase in transmission and probably its possibility to evade vaccines, which hasn't been proven yet by WHO, but we don't know how it's going to work. So Nepal has 18 districts that are closely connected with India. We have 7 major borders and 16 minor borders, and without any fence, and multiple porous borders with India. 5 districts in province 7 of Nepal shares its border with Uttarakhand in India, where Kumbh Mela, the largest Hindu religious festival, was held. In 2 weeks between April 26 to May 9, there were 92,472 new cases with an average of 7,522 new cases each day. However, the number of tests done in province 7 of Nepal, which shares its border with Uttarakhand in India, between April 26 to May 9 ranged between 209 tests to 1,216 tests for 9 districts of Nepal. Likewise, 5 districts in province 5 of Nepal shares its border with Uttar Pradesh, UP in India. The total number of new cases in Uttar Pradesh of India between April 26 to May 9th was 416,865 new cases, with an average of 23,000 new cases each day. However, the number of tests done in province 5 of Nepal, which again shares its border with Uttar Pradesh, was 1,217 tests to 2,191 tests each day for the same period. Likewise, in Bihar, India, the total number of new cases each day was 11,259 on average, and 187,880 cases were reported between April 26 to May 9th. Bihar in India shares its border with 8 districts of province 2. There are 8 districts in province 2 that shares its border with Bihar. The total number of tests conducted for 6.1 million population, that is 23% of our population in province 2 for the same period, April 26 to May 9, ranged between 232 tests per day to 673 per day on May 9th. So the most challenging province is province 2, because most of our borders are located in this province, including many porous borders. This is one of the more poorest, densely populated province with 56% literacy rate. Most people do not even understand Nepali language. They speak in their mother tongue. The Human Development Index is low at 0.5. Bihar on the other side of India also has a very weak health system, which is why it's not possible that people from Nepal would be getting services from the other side in India. Many epidemiologists from India have admitted that for a population of 1.3 billion, the number of tests performed and the deaths do not reflect the true situation, and no one knows what's the true situation, and we believe the situation is similar in Nepal. The number of deaths could be even higher, because those who have died at home or who have died without even getting tested would never be a COVID-19 death. And the number of tests that Nepal can do is limited, which is again very similar with India. Although there has been a lot of efforts and an ongoing discussion to convert hotels to quarantine centers in Kathmandu, but this is not possible in province 2, province 5, and province 7, where some of these districts do not even have a hotel or a proper place to stay or eat. The other recommendation that I've noticed is contact tracing. Yes, it's a very important tool which can still be done in districts with low number of cases and with a proper place to stay. But contact tracing is very challenging in densely populated areas with no isolation and quarantine centers, because the incubation period of COVID-19 is up to 14 days, with 5 days on average before the person starts to develop symptoms of the disease. The diseased person is also infectious 48 hours before developing symptoms. So if we average 5 days of incubation period and 48 hours before developing symptoms, we only have 3 days window of opportunity to isolate that person before he or she starts to spread that infection to others. So we just need a lot of contact tracers. Number 1, who can speak a local dialect. Number 2, who can follow up the contacts to ensure that they are well. And number 3, most importantly, we need a proper referral mechanism where the contact tracers can refer the client if symptoms start to deteriorate. This should have been done at the initial stages of the pandemic, but I don't know how feasible it is right now, given that many hospitals do not even have oxygen or bed or ICU. So given this challenging situation, with most of our resources concentrated in the urban areas, which has already started to stop its services, the extremely poor who live on $1 to $3 per day, which is 8.6 million of our population, might just die if they contract the disease. Therefore, we would like to request the international community to support us in saving lives of people in Nepal by helping us with making the vaccines and other medicines oxygen available. We have already seen that the estimates of fatalities by SAGE modelers for Britain has almost reduced by half due to vaccination. So we know that vaccine works. So our first and foremost request is for vaccines and oxygen. And thank you once again for giving me this opportunity to put forward our issues. Thank you.
Thank you, Dr. Lhamo, for very detailed, very, with lots of evidence on what's going on in Nepal, in different parts of Nepal, and for pointing us to, vulnerable populations, vulnerable areas within Nepal. We'll straight go to Professor Chandrakala Sharma, who is the chairperson of Nepal Nursing Council. We will share some insights on, the role played by healthcare workers, as well as the impact on the healthcare workers of the pandemic. Within 10 minutes, Professor Chandrakala. You're on mute. Yeah.
Thank you very much, Jivan sir. So, first of all, I would like to thank British Nepal Academic Council and University of Edinburgh for providing this opportunity to share some of the views and opinions related to COVID-19 situation in Nepal. So, as you said, as we know that the cases are rampantly increasing and the death rate is increasing from 1 digit, 2 digit, and 3 digit. Like yesterday, the death rate, number of deaths was 225. So in the first wave, as Dr. Onta said, we had only 1, 2, some days there was 0 death in our country. So as we know, the cases are rampantly increasing, and as we know, the positivity of the testing is more than 50%, and the cases are rampantly increasing, and also the incubation period is very, very important. I just want to share one of my experience at the end of my opinion. So at present, as we know that cases are going very high and the hospital beds are very less in comparison to the new cases every day. So we do have beds, but there is extreme shortage of beds. And not only the shortage of beds, there is extreme shortage of human resources, extreme shortage of logistic, even there is extreme shortage of equipments. And as we know, today it is an International Nurses Day. Today is May 12, and it is the International Council of Nurses Day. So it is what I want to say, that the nurses, they are worldwide warriors of COVID-19 pandemic, and make them strong fighters with well-equipped and great support. That is our slogan, and that is our strong debate in uplifting the morale, in uplifting the self-esteem, in uplifting the mental state of the human resources who are working in this pandemic situation. And as we know that at present, not only the shortage of infrastructures and shortage of beds and shortage of equipments, it's not that only. We do also have another problem, is that many health workers, nurses, and other health workers have been infected. So we can see outside the Kathmandu Valley, as Lhamo Sherpa, she said, the situation inside the Kathmandu Valley and outside the Kathmandu Valley is very different. It's different when you compare to the rural and the urban area, urban setting of the urban healthcare settings. So we can see, we can read from the news also, some of the infected nurses are taking care of the patients who are having a positive, who are having COVID-19. So not only that, and yesterday only I talked with the Tribhuvan University Teaching Hospital nurses who are in charge of taking care of COVID patients, and even in teaching hospitals, there are around 40 to 45 nurses are infected. But luckily, they have been given leave, and they are on leave. They are having rest, and they are taking care of themselves. But that is not the situation outside the Kathmandu Valley. And keeping in pace the shortage of the human resources, many hospitals like Beer hospitals, teaching hospitals, and other private hospitals, they have called for the appointment of new nurses so that they can work on the non-COVID wards. And the nurses who have been experienced in working, they can be shifted into the COVID wards. So that is the strategy has been started. And related to this situation, during the first wave, we just conducted a research, and we tried to see the anxiety, fear, and depression among the healthcare workers. And we found around it's 29 to 36, 35.6% of the health workers, they're having a lot of symptoms of anxiety, fear, and depression. And definitely the COVID-19 has impacted the healthcare workers psychologically, mentally, socially. And in the beginning, as we know that even the community people, they did not accept the healthcare workers. If the person is living on the rental homes, they were asked not to come to the homes. They were asked now to stay back at the hospital. So this was the situation. Even now, still people don't want to share those things. And many health workers, they had a problem, staying in the rental homes. So in that situation, some of the hospitals, they have to plan to have those health workers to provide residence nearby the hotels or even in the hospital premises itself. So the impact has been, it's very increasing, and they do, even the health workers, they don't want to go back to the home because of fear of infecting the family members, fear of infecting their loved ones, fear of infecting their dear ones. So that is the situation. And at present, it's tremendously, it's a very huge shortage of human resources. Even if we are able to build up the infrastructure, even if we are able to put the beds and all the logistic supports has been got, the human resources scarcity is very high. So if you have any other more questions, I can come back to you again. So thank you very much.
Thank you, Professor Chandrakala, for that very valuable.
And one thing I just want to correct Jeevan sir, but at present, I'm not the president of Nepal Nursing Council. And I'm working in Marathon Nursing Campus as a vice principal, and my area is, I'm a psychiatric nurse. Thank you.
Yeah, apologies for that. Thank you so much for being here and for sharing your inputs. And I'm sure we'll come back to you with a few questions on health workers.
Sure.
We'll now go to Professor Padam Simkhara, who will talk about some of the lessons that Nepal can learn from elsewhere.
So thank you. Good morning, good afternoon, good evening, everyone. Jeevanji, can you see it?
Yeah.
Okay, so after this, we have a better insight now about the situation in Nepal. I just want to highlight some of the lessons learned from the management of coronavirus pandemic around the world. So I just want to highlight and compare that, as the Dr. Onta and the Dr. Lhamo also mentioned, that sometimes in Nepal, we are just looking the number and it's been shadow because of the high death number in India. But if you look the case and compare that with the population, 1 million population, it's a Nepal and India has a similar condition at the moment. And this is the graph I have taken from the news brief from the Ministry of Health. And also looking at some of the Indian data, that's around 300 new cases, per the 1 million population, then you can see that. And if you look this, a lot of people already mentioned that the positivity or positive rate in Nepal is nearly double than India. So that means there is a large number of undiagnosed cases in the community and it's spreading so quickly. So this is the quite worrying situation that's there. So from that one, if you look the daily or weekly death rate, the Chandrakala also mentioned the number, yesterday's number. If you look the weekly average, there is about 3.2 death per 1 million population in this week. And if you look at Delhi, if you pick up the yesterday's number, and then the average death rate in Nepal is 7.7 per 1 million, which is more than 2 times higher than in India. The Indian death rate is 3.1. So condition is quite serious than we thought. When we compared to the Indian number, then we thought that, oh, Nepal is a bit shadow. And that's why a lot of Western media is focusing and a lot of effort is focusing on India, not for Nepal. But this indicate that the situation in India, Nepal is quite serious. That's very interesting editorial this week in Lancet. They estimate that about 1 million deaths in India by August 21st. I'm currently working with some epidemiologists in the UK universities, and we thought that in Nepal we'll have at least it's all depend on the all this preventive effort, but it could be around 15 to 20,000 deaths by the end of this year in Nepal. So again, it's all depend on the government intervention, and then some of the intervention that we mentioned earlier, like the vaccine and public health measures, treatment and care of the people. So Nepal's situation, as a lot of other colleagues mentioned, the health system is now in breaking point, and public health system is also beyond the capacity. And then the government response, sadly, on the second wave, I know some people may not agree on this one, is poorer than the first wave. And a lot of this is due to the political conflict that we know within the party in Nepal, and also among the parties. And a lot of energy is about the how to survive the party rather than how to deal with the pandemic. That's why this is as the previous speaker, I think the oxygen, equipment, drugs is the first things that Nepal needed at the moment, and the vaccine is again is very important for this prevention. So I think Nepal should continue. I think, as the Firaz also highlighted earlier, that should continue on the public health measure, should continue. We call it the Swiss cheese model of this sort of from the more sort of personal responsibilities like physical distance, mask, hand hygiene, to the more sort of sheer responsibility like quarantine, isolation, vaccination, care and treatment. Those is even equally and more important now in Nepal case. So what lesson we learn? I mean, that's something that I want to share. Is in any COVID management, if you look globally, and then some of the successful country like the New Zealand, Australia, Vietnam, and some of the failure country like US, India, even in the UK in the first wave, and Brazil and those countries, there are certain common character, common features. It's not just the doctor or health worker or health capacity that can solve the problem. It's more about more than the health system. It's a lot of other management issues like transparency. The number of cases that we got, what's going on, is a vital for this there's a pandemic. And successful response hints to the decisive leadership. I think this is something the COVID teach us, that the successful leadership is such a vital thing on this sort of response. And then also the most sort of unified response. Some of the countries that are successful have a unified response rather than diverse, disconnected strategies. And more importantly, effective communication must occur at highest political level, and that need to be communicated properly to the public. Accountability is critical for building the trust and for the sound, inclusive decision-making, and responsiveness and resilience on the health system, and make the changes and improvement based on the outcome and the science is more important. So that if we learn from this country, if we look the US case, for example, has a lot of doctors. I think most doctors and the best healthcare facility in the world. But in the first wave, even now, we can see that the case is quite worse. So it's how we take that public health measure. And as the Firaz already mentioned, that the country that believe on the herd immunity is getting really worse outcome. I think this is completely unethical, unscientific, and then that's why, I mean, so Nepal, I think first this step need a more sort of care and support treatment response. And Nepal also, and we as an international community and scientific community need to think, is there any sort of things we can do when there is no oxygen? Is there any sort of there is some protocol, some treatment, some evidence coming up about the use of steroid in the most sort of when it's diagnosed, and that help to some extent. That need to be, I think, they look that carefully and roll out in the country like Nepal, where the hospital, even Kathmandu, is stop taking the patient. Then you can imagine that's how it's happened. I recently took part in one of the discussion in Lhamo village, where there is a 67 household, and all the household have a positive cases in the village. So it's not in the capital only, it's all over the country. Things are getting worse, and the less I think we need to work to address this problem together. Thank you. I will stop here.
Thank you, Padamji, for that intervention, and I'm sure we'll come back. People already have a few questions to you. We'll straight go to Professor Ian Harper, who will draw on his long experience of working in Nepal on infectious diseases, including distribution of pharmaceutical products, as well as implications of that for vaccine distribution. Ian.
Thank you very much, Jivan, for inviting me here. I'm here to learn as well, and what we might hopefully be able to do collectively. Now, I've not been directly involved in COVID research, but I do have years of experience with infectious disease work, and I'm as an anthropologist, I also want to introduce some aspects of what we think of as a biosocial perspective. So this is to sort of supplement some of what we've already heard. So we've heard the epidemic has spread rapidly. Sadly, treatment and prevention are limited. Vaccines, as Professor Farrar said, are not going to be the answer for this wave, unfortunately. But what happens is with most rapidly spreading infections is that there are cycles of blame and accusation that come at multiple levels, and that's the first point that I wanted to make. So there are on individuals, for example, around groups, and at national and at international level. Now, the literature historically and across the globe from other pandemics and epidemics point to both the inevitability of these narratives of blame and accusation, and also the importance of resisting and associating infection with certain groups and the stereotyping that comes with it. And I'll come back to that in a bit. But I wanted to suggest that most infectious diseases, in fact, nearly all infectious diseases, ultimately in the medium and the long term, inevitably track along the fault lines of socio-economic inequalities. They are exacerbated by poverty and social deprivation, as we heard from Lhamo's talk about, what's happening down there. So it will be the most marginalized who will be the most disproportionately affected and the least able to access health services. Those with precarious jobs in the informal economy will be most disrupted by the virus, by lockdowns. And we've seen, and I've seen this over many, many years with tuberculosis as well. It's just one other example. Tuberculosis is an airborne infectious disease that spreads through the air and disproportionately affects and kills the poor, the marginal, and the economically deprived. And once this wave of recedes of COVID-19, it will almost certainly become endemic. There'll be further waves, but it will impact the marginalized most. And I think they will be and will remain invisible and uncounted. And so one of our main focuses should be on understanding and trying to ameliorate the social conditions around which it will spread. Now, just to go back to blame and origins, this is very important for epidemiologists, of course, and public health. But the blame that tends to come with it is something that social scientists will study. And this blame can be on individuals for causing the problem, on certain sets of religious practices for causing the problems, and on cultural practices. And it would detract, I would suggest, from getting the work done. And it's far worse too when nationalist sentiments come to the fore. This is not a comment about Nepal in particular. This is also we've seen it in the UK with our current government and so on and so forth, which I won't go into. It happens everywhere. What's encouraging though is that in Nepal, stigma and discrimination with COVID has already been quite widely reported on in the public health literature. We heard from Chandra Kala about the stigma associated with health workers. There's awareness of this. There's those who have the misfortune to have been infected and recover, returnee migrants, Muslim populations, and a lot of the Nepali Times, the Himalayan Times, the Kathmandu Post, amongst others, have raised this awareness. I'm less aware of what the Nepali media is reporting on it. But we must try to understand this and its impact, and not thoughtlessly feed stereotypic ways of thinking about things, and then counter them as far as we are able. And it's really heartening to see that in the first wave, this was a concern and was raised. Now, my second point is on vaccines, but I want to make it a very specific set of points. It's not actually just about vaccines, it's about distribution networks. So vaccines, as we heard, are important, but and in the medium and long term will be part of the solution, of course. But we need to be wary of thinking that this technical intervention in and of itself is that all is required. We've shown when we've heard how vaccine distribution, production and distribution reveal global inequalities. Now, in work that I did a number of years ago, Nepal will not be producing its own vaccines. Now, please correct me if I'm wrong here. National companies do not have the technical capacity, or indeed the will, to do it. And Sri Lanka, I believe, is the same. And Bangladesh, although they are testing some vaccines, also has a similar problem. So Nepal will be dependent and will remain dependent on importation. So what does that mean? Well, it means that there are various mechanisms for, we've heard globally, but I want to sort of narrow it down a bit. So we have the India Serum Institute, was a local manufacturer of Oxford AstraZeneca vaccine, known as Covishield. Now they have stopped, they had I think it's called Vaccine Maitri Assistance Program, and they were giving or selling at cost vaccines to Nepal. There was in a recent Kathmandu Post article, this was embroiled in controversy with importers demanding money, for example, and lack of clarity around contractual obligations, something that we've seen in many other parts of the world. COVAX is another mechanism, but that will only ever provide 20%. And the Chinese will donate as well. Now, what I want to highlight, just to finish, in just the last few words, is to ask is, well, what are the chains of organizations and actors that are involved in this process, both before and once they arrive in the country? This is about pharmaceutical distribution chains. So this is for production, importation, and distribution. And these chains are really complicated, and how they work in practice is not often what we see on paper. There are many institutions and companies that are involved in this hugely complex edifice: producers, manufacturers, importers, wholesalers, retailers, clinics, doctors, NGOs, and so on. It's a very complex regulatory, scientific, ethical, legal domain. And so what I would recommend, and or make a suggestion, is that what we need is rapid research. And if this may already be going on, but if we follow the named vaccines, or if we follow the oxygen cylinders that we've heard about that are not available, or we follow the hydrocortisone steroids that we know is one of the treatments that can actually has been proven to help people, and we think about this both in the public and the private sector. When issues arrive, you know, every time they exchange hands, what's happening? What profits are being made? And this can be done quite quickly. And we've heard about the importance of trust in the system. And it's a major issue, but where are these blocks, and where, and I think what's heartening is that concerted rights-based activism can make a difference, because the raising of public awareness is happening apace. It's happening now. We never used to see articles in the paper around vaccine, you know, and around distribution programs. And pharmaceutical companies and the organization involved in distribution networks, they want positive press. They want to avoid negative criticism, and I wanted to finish on that note. So just thank you.
Thank you, Ian, for that. Lots of issues. I think you know, all the panelists have raised a really interesting set of issues based on, you know, both experience as well as the expertise on a range of you know, pertinent questions. So what I was going to do is there are a number of questions that have been raised in the chat box. So I was just wondering if Dr. Onta, if you're there, yeah, there are a number of,
I'm here.
Yeah, there are a number of questions for you. I don't know if you managed to have a quick look at those, or, you know, if you want me to read them out, or I can just direct the person who's asking this question to ask that question himself or herself. Have you read the questions for you? I think there was one on first and second wave, the timeline of that, a clarificatory question. David, do you want to ask that question yourself? David Gellner?
Yeah, please.
I mean, the question is very clear. I think Mark Watson has probably answered it, but it was just I didn't get it when you were making the original presentation.
I think you mean that how I divided the time period of the first and second wave, yeah?
Yeah, it was a very simple question. When did the first wave start? When did the first wave end?
Okay, well,
simple question.
Yeah, simple question is, that the first case of corona was identified in Nepal on 23rd of January 2020. This is what we start at the beginning of the pandemic in the country. It's 23rd January 2020, but fortunately that the second case was detected after about 2 months' time. So therefore, there was a long window period for us, as Dr. Padam also mentioned here, that we had a long window period, and then the peak of that phase was sometimes at the end of October, and then it started declining, and therefore at the end of March or mid-March, the daily case was reduced to 60-70 cases per day, and this situation continued for about 2 weeks' time. Therefore, from January 3rd week to mid-March, we consider as a first phase, our first wave of situation. Yeah.
Thank you very much. And I see Professor Tony Costello is here. Thank you, Tony. We just got you here. So I was wondering if, in about 5 to 7 minutes, very quickly, Tony, if you wanted to kind of comment on the role of the international community and the WHO in particular in addressing the immediate sort of challenges facing in Nepal, as well as the sort of more medium term in terms of vaccine distribution. If you wanted to comment on that.
Yeah, I'm so sorry. I couldn't get in, and so I was a bit late in joining. So I really apologise for this, and also for not answering earlier email. Gosh, where to? I mean, Nepal is being hit in a way right now, like India, which is terrible. In the same way that we were hit in November, December with the last variant, the so-called Kent variant. And now, of course, you're being hit by this new so-called Indian variant B1617.2, which seems to be the one that is extremely transmissible. And we're also seeing, actually, the assumption here in Britain, of course, Johnson's riding high in the polls, case rates have come down, but they haven't actually disappeared. And in the last week or two, they've started creeping up again. And we are seeing quite a rapid expansion, albeit at a low level, of the same Indian variant. Now, of course, we have an advantage that, 36 million people in the UK have been vaccinated. And actually, the one success of our government has been that they did act quite fast to get deals in with vaccine companies. But of course, that's not open to Nepal either financially or without production capacity. And I guess that you have been dependent upon the Serum Institute of India to get hold of any vaccines. The problem with COVAX, which should be there to help Nepal, is that their targets are simply not being met, partly because the World Bank and others are funding countries to do their own deals with the pharmaceutical companies, which undermines COVAX. Do you see what I mean? So that, they failed to make any of their targets for May. And initially, I mean, a few months ago, I was sympathetic to the view that one should do voluntary deals in order, you know, because it seemed to me that the AstraZeneca not-for-profit deal with Serum Institute was a good model. But clearly the whole market mechanism is not going to work for this pandemic. And so I was really pleased to see that, you know, Joe Biden came out and showed leadership and said, you know, we have to have a patent waiver. Now, that's not going to immediately solve the problem of getting vaccines into Nepal. But it just strikes me, I'm so sorry I missed Jeremy Farrar. I don't know if he talked about this, but, you know, in India, I think there are 9 companies that can make vaccines. And it strikes me that the AstraZeneca vaccine, which is based on a DNA model using an existing virus, an attenuated virus, is not that difficult to make. I'm no virologist, and I may be wrong, but I get the impression that other companies should be able to do this if there is a proper patent waiver. And I just don't know what the European role will be here, because the Germans have come out against a patent waiver. But it does strike me that there are lots of companies around the world that, if they know they're not going to get sued, should be able to make this vaccine. The RNA vaccines are more complicated to make. But, you know, we've had a year to think about this, and you know, what's happening in South Asia is catastrophic, and no doubt this is going to happen in other parts of the world. And we're in a, you know, pretty titanic struggle with this virus, because, you know, the virus's only intention is to survive, and it will throw out new mutants all the time. And of course, the ones that transmit the best will get selected out. Now, the hope, of course, is that the virus will solve the problem for us by creating a very transmissible virus, but one that isn't so virulent and causes so much death and destruction. But the virus has no particular interest in that, whether it becomes virulent or not. It just wants to survive. And at the moment, it seems that the new Indian variant is not only more transmissible, but also perhaps more transmissible than the Kent variant, but also could be even more, you know, fatal in various ways. So, yeah, life is very difficult. I'm really sorry I missed the presentations. I was very keen to know what's going on in Nepal. But clearly, with the vaccine waiver, patent waiver, if that goes ahead, with increased finance, and particularly with giving support to pharmaceutical companies in the subcontinent, hopefully we can start to roll out vaccines much quicker in the coming months. But that doesn't solve your immediate problem, which is going to be much more about oxygen, steroids, ICU beds, and the like. So I think I'll stop there.
Thank you, Tony. The number of questions. So I was wondering if we should sort of, you know, think, you know, of course there will be opportunity to answer some of those questions, you know, by the panelists, but also to think about, you know, what can we do, what can be done in the immediate sort of, you know, sort of time scale, you know, knowing about, you know, about shortages, oxygen, or sort of, you know, beds. There are comments on use of steroids, unsupervised steroids, for example, and the sort of, you know, obviously there are governance issues around that. But what can we do as those who are, you know, currently living and experiencing this in Nepal, and those of us in the UK or overseas? What can we do immediately? You know, we know that, you know, what's going on in Nepal is very much linked to what's going on in India, not just because of the open border, but also because the response to the, you know, any sort of emergency, India would be the obvious place to look at. But India, it's, you know, is going through that, you know, whether it's about oxygen supply or pharmaceutical products or equipments or, you know, vaccine. So that seems to be the sort of, you know, the bigger sort of, you know, issue here. So could panelists, you know, or others from the floor, you know, those who want to sort of comment, if you raise your hand or, you know, if you just type, I know that, people have asked questions, but also to think about not just, in terms of asking questions, but also thinking about what can we do. Dr. Onta, I see your hand there.
Yes.
And others. Yeah, please go ahead.
Okay, I think these are very, very pertinent questions, and we are trying to find the answer to these questions. What should be done immediately? And one thing I very much agree that the vaccine is not the solution of the current surge of this pandemic, because it will take a long time. Therefore, this wave, the second wave, as its nature is slightly different from the first wave, it will very much influence on our management and response strategy. The first thing is extremely important, to break the chain of transmission. This is the first step that we have to be very careful. And for this, I think the border management is very, very critical, because even today, the import of the cases are continuing, and we have not doing anything in the border, because doing few tests few tests will not solve the problem. Therefore, it's extremely important to manage the border. It means it's not to close the border, but without closing the border, we can manage very safely, because this is also the lesson that we learned from the first wave. This is the first thing. And the second is, of course, we have also to have a very strategic program to break the chain of transmission within the community, because this is not only the imported cases, but now the sources are already existing in the society, in the community. Therefore, the community transmission should be stopped. This is extremely important. And the second point is, I think since the number of the cases are increasing and the symptomatic cases are increasing, it's very important to manage the cases. And we don't have any strategy to manage the cases at the home, because there are almost more than 90,000 people are living in the home. I mean, 90,000 positive cases are in home isolation, but we are not taking any care of them. Therefore, it's important that we should have a very, very strong strategy, very effective strategy to manage, to respond to those who are living in the home. And also, of course, those who cannot stay at home for clinical reason or for practical reason, we have to manage in institutional isolation and then in the hospital. Of course, we cannot construct a new building for hospital now. It's not possible. But we have a lot of those structures which can be converted into hospitals, and we have to do that very, very soon. And concerning the oxygen and other medications, I think we do not have shortage of other medications now at the moment, but we have shortage of oxygen, and the shortage of oxygen is not because of the less production and the production capacity of the country, because there are private sectors who are producing enough oxygen, but we have problem of cylinders to transport it to the hospital, because our hospitals are not that sophisticated. They have this, very few hospitals have a central supply of the oxygen, but most of the hospitals need oxygen. I mean, cylinders to supply the oxygen. Therefore, the deficit of the cylinders is major problem. And one of the problems related to the inadequate number of cylinders is that now a lot of households are holding the cylinders, because that is the problem.
Yeah,
I think we can manage that.
Great.
And we should manage that.
Yeah, I see a few hands already, but also to kind of think about if there are supplies, sort of concerns on oxygen cylinder, or what can we do as well. I think thinking about what can the government do is one thing. Can we do something as sort of individuals spread around in different parts of the world, as citizens, as concerned global or Nepali citizens? I think that's also something I think I would like the panel to respond, but also Professor Sarma.
Yes, thank you. Thank you very much. I saw a question that it was like, how do we nurture our well-being in this COVID pandemic? So I just I want to share one thing that from the beginning of the first wave, and we conducted a webinar, and the Nursing Association of Nepal and American Association of Nursing, Society of American Nepalese Association, in collaboration with SAN and NAN, we conducted a webinar, and we tried to bring together the nurses, and we tried to focus on various informations, and the information was focused on related to COVID pandemic. It's sometimes it related to the pathophysiology and other things, how the transmissions, and we do also focused on the vaccine. So we try to give them more information, and together we try to focus on the stress management techniques. So different techniques like mindfulness, meditations, exercise, those techniques also were incorporated during the webinar period. And we had a weekly webinar, and that was one of the part which was done from Nursing Association of Nepal. And not only that, now the Nursing Association of Nepal, they have formed a committee, and they have announced that whosoever nurses are in a problem related to COVID pandemic, so they can contact that group, and they can provide help in terms of problems related to their infections or other things. So we are trying a level best to bring the nurses and health workers together. We focused on that, and also we tried to call different non-governmental organizations who are working on uplifting the mental health. So we try to call them, and we try to educate, and we try to provide awareness and the programs for nurses, so that they can share up their problems, they can come up with their pent up emotions and share with us. So we tried to create a platform so that we would be able to uplift their mental state and provide a positive mental health for the health workers. Thank you.
Thank you, Professor Sarma. Padam ji? Yeah, that's a couple of questions related to me. And rather than going to the individual question, I just want to highlight, I think, for the immediate things, I think we need to have those sort of the medical clinical care services essential. People are dying. So, and oxygen is the main, as Onta mentioned. That's, I think, it's very important. And also the equally is important to take the consistent public health message to the public for the prevention. And chain breaking is the, I think, quite crucial at this stage. I think we know that there is enough window gap that the government could utilize that gap for the preparation so that we can deal that problem. So I think it's late, but it's not too late even to come to worse. So I think that priority should be on this one. I can see that Dr. Onta and a few public health colleagues in Nepal highlighted that. I read the Onta's interview a few months ago in the newspaper saying that, oh, we are not ready yet to relax. But there was a lot of relaxation, and a lot of political people in India. The health minister declared that we win the COVID-19, now we don't have anything. And then all this happened. So I think we need to give this message that the problem is not over, and the problem is still worse to come, and we need to prepare that. So the focus, the key message is we need to support for this clinical support. That's mainly the oxygen, and also the clear strategic communication is such important. There's so much misinformation and then wrong information in the community, and the problem is all over the country, and that's quite important to take this consistent message to the public. And anyways, I know some of the colleagues mentioned that, can we pressure to the government or our local leader? I think, I mean, there's a huge Nepalese diaspora currently living outside the country. Of course, they can communicate and provide the more sort of the psychosocial, psychological, and any sort of moral support or help either to the local leader to focus on this problem, and also use the network to supply this one. I think importantly, the initiation should be taken from the government level to import some of the essential things, like the government just took I think 400 cylinder from China yesterday. I think that's sort of the
most essential equipment should be supplied, and I think we all need to put some pressure, support, or work together. I think we shouldn't now go for the blaming game or the fighting each other, rather than working collectively is more important now.
Yeah, good.
Thank you, Padamji, for that. And I think there are a number of comments as to what can we do. And I know that BNAC, Britain Nepal Academic Council, is taking lead in writing to the FCDO with the sort of points on oxygen as well as vaccine supply. But also to think about, yes, apart from putting pressure, things like, obviously we as individuals cannot fly in oxygen like governments can do. China has, I think some few hundred cylinders have landed, and I think few more hundred cylinders are going to be landed in the next few days. But are there things we can do as individuals here in terms of pulling resources, pulling networks to directly to health institutions, to health workers? It seems that a lot of the things that needs to be done would need to be done by the governments, and the only thing we can do is to try and put pressure. So any other sort of comments? Ian, did you want to come in here?
No, just the comments about what kind of leverage and what's the best way to do it, and does it make any difference? I mean, I've noted the big petition that's gone around from the US, for example. And again, I think a lot, and this is my lack of understanding here, but I think a lot of our well-intentioned ideas can come unstuck because we don't fully understand the legal and sovereign and other related issues. So particularly when it comes to bringing in equipment or things into Nepal, which is one way clearly in a humanitarian emergency that many people want to help. So I guess I'm speaking from a position of ignorance here, and to ask others about what are the best ways to help here. I think there was I suspect that leveraging the I'm sorry, the comments are coming up so fast that I'm losing track of them. I think Fraser had Binak is trying to use the special relationship that we have as one mode of trying to, and that certainly seems to be one way forward. Is that right, Fraser?
Yeah, that was the plan, and yeah.
Yeah, okay.
We've drafted a letter at the moment, so we've hopefully
yeah.
start to share that today, actually.
But Tony might have a better sense of, given this Conservative government, given the fact that they use COVAX as their excuse for not doing anything, we'll give a bit of money to COVAX, and that's our kind of moral obligation to the rest of the world sorted. And given the massive aid cuts that we've just had, what are the likelihoods of these types of activities making a difference?
Yeah, I mean, Ian, I'm not confident, but I think, it wouldn't do any harm for the Britain-Nepal Academic Council to write a joint letter to Dominic Raab, the foreign minister. He seems one of the more reasonable. I better not say anything. But if we wrote and said, look, Nepal is in crisis. They fought for us for 200 years. We have a very close relationship. And even, getting Prince Charles or someone on board, Joanna Lumley, people like this who have media presence. I don't know. I do think writing a nice letter coming from a lot of us here to Dominic Raab, you never know, might engender some support. Or even, who are the best MPs on Britain-Nepal relations, particularly in the Conservative government? Getting them on board would be useful. I don't know who they are.
Yeah, we've got a letter now, and we have actually played up this kind of 200-year relationship, you know, the Gurkha regiment and so on, because, you know, that's the kind of thing which attracts the Tory government as well. Yeah, but I mean, Jivan, I don't know what's your plan for that. I mean, I maybe wanted to talk about that briefly and the content of that letter and what are the key points that we should bring forward in it. Well, we've got people like Anthony here to advise.
Yeah, definitely. I think, you know, as Fraser says, you know, we have begun to sort of, you know, draft a letter to, you know, Dominic Raab, precisely on those points. And I think Jeremy Farrar sort of made those succinct points very much resonating, you know, our points very much resonate to those. I think, you know, what we are also, you know, that's one sort of set of thing that we would be doing in addition to, I guess, you know, Tony, your point on reaching out to, you know, those who have some sort of, you know, sensibilities to do with Nepal in terms of, you know, connections of familial, otherwise humanitarian, otherwise sort of connections. So I think Michael Hutt has this sort of suggestions that just come, you know, Britain-Nepal Society, and there are a number of diasporic informal networks, which is what we saw being mobilized during the earthquake. And this time around, it seems that, you know, in the pandemic, you know, there is a lot of goodwill. People want to sort of, you know, make donations. People want to sort of help. It's that sort of mechanism is where we seem to be kind of, you know, finding the void, you know, when it comes to transporting oxygen, say, or transporting even volunteers wanting to go and help, you know, who've been vaccinated. Other things that could be done, you know, Nepal has, Britain has a large number of Nepali healthcare workers, nurses and doctors and other health workers supporting the population here. And there is a lot of good sentiment there as well. So definitely, I think we need to kind of, you know, find groups, you know, outside of the government also to try and channel some of the donations. Alongside, I think Padamji had this, you know, sort of a model there. Need to kind of look at, you know, in the immediate term, midterm, and the long term, what are the different things we need to do? I think we should do all of those, but we just need to know the right way, find the right way to get those things done. So yes, the letter, I think, Fraser, we can share it to you know, to the group as well, and to bring it out as a statement in addition to writing to FCDO. But others, I think there are a number of other sort of suggestions. And I was wondering, Tony, and others, those who have, you know, significant leverage in terms of scientific voice and the network that you have, Tony, for instance, if we could sort of leverage some of that, you know, to respond for the immediate crisis. Obviously, definitely for the vaccine, which is everyone wants, I guess, you know, not just Nepal, but in terms of oxygen supply or other kind of, you know, resources.
I'm not sure I'd be the best person to influence the government, but certainly I agree with Michael's suggestion about all the many links, you know, through the Britain-Nepal Society and all the rest of it, getting a letter, getting it to Dominic Raab. I'm very happy to tweet about this, do a bit more about the specifics of what Nepal needs. And I'll try and get some other people to do that as well. But it's more getting access to people who have influence with the current government, which people like Ian and I wouldn't have, I think.
What about, like Tony mentioned, MPs? I mean, I wonder about who are the MPs in some of the kind of cantonment towns, like Aldershot and places like that. I don't know who they are, but it might be worth finding out. There's a bit of a local interest there as well.
I think I'm also wondering whether we can use some of our Nepali origin recently elected mayor who were from conservative.
I was thinking of that too.
With the prime minister and a few other leaders. And then we can approach them. They are very approachable and they are keen to support to Nepal as well. So the politicians who are here now from Nepali origin and have a close link with the Tory government.
Yeah, and I think there are a few suggestions already in the.
Yeah, I think there are all. Jivanji, I mean, I was thinking to speak a bit late anyway. There are other platforms also active here, NRN UK and, you know, Embassy and other, you know, other groups also are organizing these kind of things. I think we have got many Nepali councillors, as well as there. I think we should also write to MPs in order to build that pressure. There is Nepal Parliament in Nepali groups. I think we can approach them. I'll also, make a small presentation at that towards and to thanks on this topics. Thank you.
Yeah. It's very, very useful, I think, definitely. And, a couple of days ago, the Prime Minister of Nepal has made an appeal to the UK on questions of vaccine, I guess. So I think, it's very timely that our statement sort of, very much resonates or adds to that pressure. And I think there are suggestions. I think Michael said there are already sort of, experiences from the earthquake in terms of, donations, whom to give money. We know that the Development Emergency Committee, I think they raised an appeal for India. I think we should also sort of maybe try and sort of leverage our networks to make appeal for Nepal as well. I think, definitely government to government support is great, but we should also, as I mentioned earlier, look for other avenues of support, whatever that can be done. Yeah, there are lots of suggestions, Krishnaji. I hope we are able to kind of save all these really brilliant sort of suggestions. And if people want to kind of speak as well and say a few things, please feel free to do so. Dr. Onta.
Yes, Jivanji, maybe just
please,
just a second. I think it's just a very good. I'm so happy that the whole the concern has been discussed here, and that you are taking care of Nepal, and you are worried about the situation in Nepal. And one aspect is, of course, to provide support to the country in terms of this is how it's a financial support or technical support is a very, very important. But I also would like to request you that maybe BNAC should also somehow influence, the decision makers of this country, because those who are in the, at the center of the policy making and decision making position, I don't see them as responsible as we expect. And that is the biggest program. And I think the resources, we need the resources, but at the moment, the resource is not the number one problem in this country, because government has publicly announced several times that it's not the problem of resources. And the government has money if they want to buy supplies. But the question is not the resource. Of course, we need resource at some point of time, no doubt. But the critical point is there, the vision and then attitude and then commitment to the issue. Therefore, if BNAC somehow also have some link to communicate with the policymakers of this country, that will be very good and very big and a very meaningful contribution. Because unfortunately, the policymakers do not listen to us all the time.
Yep.
And sometimes, if we raise some critical questions, we are labeled as anti-government. That's all.
Yeah, that's a very, very important point, Dr. Onta. I think obviously, I think there are suggestions saying, BNAC should also write a letter or a statement, focusing on the government of Nepal, or the ministers, or the cabinet, prime minister. Yes, I think my own experience has been that yes, formally we can sort of using the sort of naming and shaming kind of strategy sometimes works, sometimes does not. But a lot of leverage can be made informally through the sort of whatever networks we have with individuals within the government. These advisors, people who are, I guess, advising the government system, Ministry of Health, or Ministry of Finance, or in the Prime Minister's office. I think that's really, really important. That we can write a statement And, if we criticize, the government is going to, as you say, they won't like us, which is fine. But I think what we want is, not to be liked, but to be listened to, I think. And the key sort of, leverage often comes with a lot of these informal networks that we may have, friends, families, professional networks, with the government, with these people. And that's something we should continue to do, I guess. And as a collective as well. And it's good to see that, the Prime Minister has written that in The Guardian, having denied that they need help, a few days ago. I think there is an opportunity as well that, they want, UK government to listen to them, and we are doing what we can to put pressure on the UK government. And if anyone here knows the Foreign Minister of Nepal, who seems to be tweeting a lot on Prime Minister's letter, we should get in touch with him and ideally, drag him to our meeting. I don't know him personally, but if it's about personal networks at the end of the day.
I think he is Pradeep Gemali, no?
Yeah,
Pradeep Gemali. But at the moment, we don't know whether the government is going to be changed and the minister, because the vote of confidence has not been achieved by PM, no? So,
yeah.
But if we try to connect with him, we try to get the phone number, I can do it.
Yeah. Oh, thank you. I think, if we get that, I think we should try, as you say, yes, the government, we don't know the future of this government, but
yeah,
there are people in the sort of bureaucrats, I guess, in the ministry, whom I'm sure, Professor Chandrakala and, Dr. Onta,
I think Onta sir also can, yeah.
Yeah, you're already doing, I'm sure, quite a lot of that. But if we can add any voice to that, we would be delighted to.
Jeevanji, can I ask a question to Chandrakala Sarmaji?
Yes,
please.
yes, sir.
Thank you for presenting, about all the pressure and the situation that the health workers, the frontline health workers are going through. But what do you think that could be done to relieve the kind of, the pressure or the difficulty they're facing at the moment in immediate term, at least something minimum?
Yeah, what I think is that in the first wave, thank you for the question, but in the first wave, when the COVID pandemic was there, at the beginning, people were very panicky. They were in a very panicky situation, and the human tendency is that anything new emerges, we try to see the news again and again. So a lot of infodemic was there, and people were very pandemic, and the outcome was unknown. So in that situation, people were very much in a panicky stage, and they're very much anxious, and a lot of fear was there. But I think, my experience is that this time they have known about the disease condition, they have known about the transmission. It's a novel disease, so definitely anything, the outcome is not, the outcome is not predictable. Now at this moment, you can see, I can just share one thing, one example. Just a few days back, 60 plus person was, the person had a cold and cough, and they didn't go for the checkup because due to this lockdown and shutdown. And we don't know whether that was COVID-19 or something, but immediately after 9-10 days, she passed away. So it's terrible. So, and the other family members, they're having high fever and cough, and again, dry cough, high fever, eye pain, headaches. So you don't know. So this is the situation. In that condition, people doesn't want to go outside also for the checkup. So this is the situation. And even though this time, at least they are conscious about their situation, and the short incubation period. This is the one which is creating a lot of problem among the health workers also. So at least this time they are a little bit aware, and they are more aware about how to break the chain of infection, how to take care of the patients in a better way, And in the beginning, you know, when the pandemic was there, even we had to undergo a lot of trainings on downing and duffing, because people are not exposed to that. In the previously, they were not exposed to that. So those things were there in the first wave, but at present, they are at least they are trying to uplift their mental state, and a lot of other alternative therapies, a lot of other therapies, a lot of other counseling services are going around. So I think that makes them settle down their fear and anxiety. Thank you.
Yeah, thank you. I think that there was a colleague of Ben Liana Chase who also wanted to kind of ask similar set of question on mental health in the current context. But I was wondering if we, Surochis, are you still there? I think you've shared a couple of sort of links on what groups in other parts of the world are doing, the sort of Nepali diaspora, with sort of those visuals. So do you want to say something about that, and what can we do here? Would similar sort of info sort of poster might appeal, and how could we take it forward?
Yeah, thanks, Yolanda, and thanks everyone for your contributions today. Yeah, that was just something that I think the COVID Alliance for Nepal put together to try to influence the conversations going on with the Senate Foreign Relations Committee at the moment. And I think the idea is basically just to simplify the process for citizens to actually act. So I think one approach is to write this letter that is signed by BNAC, etc., and that goes directly to specific MPs. But the concurrent plan could be to develop some kind of a basic script that we can use, and that individuals can then use to contact their MPs and their personal contacts, etc. So there's pressure coming from multiple avenues, which might actually be much more effective. So a lot of the content actually is already quite easily available, but it's just creating a format that makes it easy for people to kind of essentially copy paste and send to the right people.
No, thank you. That's very helpful. I think we can definitely take cues from that particular link and create something similar to that, which we can use. There are lots of sort of comments and questions in the chat box. I'm not going to read all of those, but people, if you want to kind of just speak, please feel free to raise your hand and read out your questions or comments. No,
I just speak of some of the comment or suggestion there, that I think the Kalpana and a few other colleagues said that there are a lot of health worker or the health educator in Nepal which has been used at the moment because they have been not involved, or the government has not engaged or involved them in the number of public health activities. What can we do? Can we how can we mobilize the unused health worker who is potentially very important, like public health student, nursing student, and other health education student in the country? Any comment on this one? Any idea? And how can we utilize those sort of workforce who is potential and important workforce, but at the moment, even they want to contribute something, they are not being utilized?
Can I add? Can I take just a few seconds?
Yeah, please.
For them, sir. Like regarding this, how can we mobilize the nursing students? Like Kathmandu University, I just saw a news and there was a announcement that Kathmandu University has been calling the bachelor level third year students and fourth year students, and also the bachelor level of nursing, like who have done the PCL nursing first year students, to come to the to contact the university college so that they can be posted in non-COVID ward to sort out the shortage of nurses who are working in COVID wards. So, and they also made an announcement, and they have also called the faculties who have been working with Kathmandu University. So that is one of the way to compensate the scarcity of the human resources.
Yeah.
Thank you.
Thank you. The couple of hands, Siva Bhusal and Ben Campbell, if you could raise those questions or comments, and I'll also I think Michael had suggested, if Joanna would like to say something after that.
Okay, good afternoon and namaste. I'm speaking from Dhaka, actually, Bangladesh. I'm based here. I'm so interesting conversation going on. Being a Nepali, I also obliged to think, we must do something, those people staying abroad. But I was thinking maybe we could categorize our support in simple kind of things like a short-term and a little bit of mid-term kind of support. I just would like to provide two suggestions here. Maybe the experience of the Britain-based organization, as you have been passed through these phases, and there are many good lessons learned, that could share to the Nepali organization, and this could kind of link could be established between the organizations of two different countries to really, help them to make sure that the public health messages are really going abroad, to the country, throughout the country, in different languages and mediums, actually, And Nepal has a very good network of FM radios, so far I know. Maybe that could be something that, lessons learned and how could we help, from the Britain-based organizations to Nepali. The second, my suggestion would be that can the Britain-based organizations really lobby and advocate, to really approach the Britain government for the AstraZeneca vaccine supply, to Nepal. I mean, Nepal is not a huge populated country compared to many other countries, but at least support from, some support from Britain government on the AstraZeneca vaccine supply would definitely help to carve, the extensions of this vaccine, that kind of support. So that's all from my side. Thank you very much, Jivanji, for coordinating this kind of discussion. Thank you very much. Over.
Thank you very much for those points. Ben.
Jivanji.
Yeah.
There is some points from the Facebook comments. Maybe shall I just present one here, if you allow me?
Yes, you go first, and then I'll ask Ben after that. Okay.
Oh, thank you. Thank you. I mean, there have been some comments in our Facebook. People are watching our Facebook Live. Right. One of them is Binay Dwaka, and he said, thank you for the effort you are making to help Nepal in this pandemic. We need help that come immediately. Do anything that saves Nepal's life in this crisis. Anything that can come fast and efficient. Thank you.
Yeah, there is a cry for help there from someone within Nepal. Yeah, we're hearing similar sort of getting similar sort of messages from friends and families. Ben.
Hello, namaste, everybody. I was just going to put a question that my colleague Leanna Chase at Durham, who was tried to join this meeting, but she said that she was informed the maximum number of participants had been reached. So that's a mark of success for you, Jivan, for having, and Ian for having organized this thing. So her question was about mental health and whether anybody had any particular perspectives on, I mean, we've had certain pragmatic considerations here, and we've looked at socioeconomic inequalities, but I don't think I've caught on anybody raising mental health issues. If there were any perspectives from the
yeah. Professor Sharma, Professor Onta, if you had any sort of insights to share on Ben's comment.
Not much at this point of time.
Okay.
Ben, I'd just say I think mental health is a huge issue for children, for families, the fear, the bereavements, the sense of helplessness. I mean, it must be massive. And one of the additional problems is that I would have said that creating community groups to try and get together and support one another is important. But of course, we have to maintain social distancing, particularly in rural areas where people live outside more and where the risks could be prevented by keeping a distance from people. So this is a difficult balance to achieve. But I do think thinking about mental health interventions immediately, but also in the longer term, is extremely important. I don't have any magical solutions.
But of course, we all know that many of the marginalized communities in Nepal have a very flexible idea of what is the household. So if you try to implement some kind of public health controls, which restrict people, there'll be very artificial divisions that probably get imposed. which in terms of mental well-being.
Yeah. So, Joanna, did you want to sort of say a few things about the kind of work you're doing from UCL?
Hi, everybody. Really nice to see you all. Basically, we just had a conversation yesterday with a whole load of people, including someone from the government, someone from FCDO, an intensivist at Medicity, and Mark Zimmerman, several people, about importing CPAP machines. UCL has been doing a lot of work on these machines, and they've imported them to lots of different places, including India. It's really not my field. I'm a social scientist, but we have been in touch, myself and Naomi Saville have been in touch with the engineers at UCL, and they have got all the logistics in place and all the methods in place to get these machines to places like Nepal. They've imported them and done research on them globally. And they do help, and there's basically a 2-week lead-in. And so we had a lot of discussions yesterday about how they could be effective. And basically we decided that they could be effective. And so we're going to ask the FCDO to support the import of them. We had some conversations about the kind of consumables that go along with them, which will be also supplied by UCL. But the engineers have done a lot of research, and they say that the good quality consumables, so tubes and masks and that kind of thing, that those are quite hard to come by. And so I have suggested that perhaps we try and import those with the CPAP machines, more of those consumables with the CPAP machines. And FCDO will probably not support that, and neither will UCL. So one set of consumables is £75, so it's quite a lot of money. We did get some indications from Deeptesh at Medicity that they are reusing without sterilizing equipment, and WHO were really concerned about that. So obviously we'd like to get consumables. So, but literally we just had the meeting yesterday. So I'm really happy to share any kind of fundraising initiative that we come up with. If possible, we could piggyback it onto something which is already happening. So obviously we don't need a lot of publicity around this. We just need the money. So I'm really happy to keep everyone updated about that.
No, thank you. No, that's really, really useful. I think, to have that sort of platform, that sort of work that's already been done, and for people to kind of donate and be a part of that that support network that has been established. And I think that it comes to me that that hospital to hospital kind of network with individual hospitals providers is equally important. We can talk to our governments in both countries, but that level of citizen level of support is equally important. I'm mindful of time, unless anyone has really burning sort of question or comment. I was just going to kind of make 4 different points, I think, which we've discussed here, and I'm sure colleagues, we will save all the text in the chat box there. I think the key point, I think, in the immediate sort of term is breaking the chain that, as Jeremy Farrar sort of says, vaccine is not going to kind of come and do anything to do with this phase of the pandemic, the current SARS. So we have to break the chain, and it seems that one of the issues that has come up is communication being quite critical, and expertise from within our network could be quite useful. Working with individual hospitals, healthcare providers in getting those communication messages, materials out. More critically, I think issues that have been raised on resources are not necessarily issues, but in terms of equipments, in terms of things like oxygen cylinder, or things like what Joanna just talked about, masks and various other sort of equipment supplies seem quite important, and that's something often we don't seem to have that kind of infrastructure to get those things run. And if people are already doing that, I think that's something we should definitely support. And the third point I think I want to talk about is the kind of voluntary organizations, informal networks that are already there. We should try and support as much as possible, in addition to the big stuff in terms of, writing to the foreign minister, writing to the government of Nepal, putting all the political pressure would, hopefully including MPs and other kind of, conservative politicians who have leverage on the current government in the UK, but also, much more broadly with G7 and the international community. I think those are some of the, sort of themes that have emerged. We will take all of these. Apologies if we've not been able to kind of discuss everything that have been raised here. We've got limited time. So I wanted to sort of, pass the mic to Dr. Krishna Adhikari, the chairperson of Britain-Nepal Academic Council, to give a vote of thanks and to say how are we taking this forward. Krishnaji.
Thank you, Jivanji. I hope you can hear me. Right, can you hear me? Okay, great, thank you. I would like to thank all the panelists and participants for your time and valuable contribution to this important issue, the current problem that Nepal is facing. Like all of you, that we have realized that the international attention particularly has not been sufficiently paid to the plights of the people of Nepal. Obviously, we are bordered to India. India is facing a grave situation, but we need equal attention internationally, and there is so much we need. And this is a small effort from the Britain-Nepal Academic Council to stimulate the issue and discuss on the matter so that we can have more and more ideas and we can do more. Whatever we can to help. We have been in touch with the DFID Nepal's office, which has now become the British Embassy in Kathmandu. They have also explained what they have been doing in terms of helping. We obviously think that it has not been sufficient. Whatever have been done is very negligible. I also have been in touch with the Nepal Embassy in London. They have been very supportive and very keen to join hands in our efforts to help Nepal to come out from this current crisis. We have got extremely valuable ideas today, and we have saved them here. Our room was full today throughout, and there have been even difficulty to let some of the people who are interested to come in, but we are live, so there are more and more people was watching this. We will save this, and also we'll try to make a small summary report, and also follow all the suggestions put forth to join hands with other institutions and organizations in the UK and outside working on Nepal. Obviously, we know that unlike the earthquake, the 2015 earthquake, when there are so many Nepalese and Friends of Nepal were coming together, and at least they could do was to raise money. I've met several people who donated to 25 different outlets. That thing hasn't happened yet. Maybe I think we could also do a small help from our own end. So there are some platforms coming up now. Maybe we need to set up some more in terms of that point of view, also in terms of making resources available. But that very important point today made, what we need, for countries like Nepal to prepare this kind of for these kind of difficult situations. And as colleagues have already put forth, shared that we have already drafted a letter appealing for urgent action from the UK government. And we have highlighted 3 important points for the immediate support, including scientific expertise, medical supplies, and we have played into the ideas of the Britain-Nepal relation for 200 years, the Gorkha relations, all those kind of things. I think we should do more to create pressure in terms of asking all the Nepali diaspora to write to their MPs in support of the cause of Nepal, to pay more attention that Nepal deserves at this difficult time. And also, I think we'll take forward this idea of joining hands with other institutions and individuals working for Nepal in order to create more pressures. Maybe we can do some joint statements and follow up. And thank you so much to all our panelists. I would like to name them: Professor Sharad Onta, Professor Chandrakala Sharma, Dr. Lhamo Pasang Sherpa, Professor Jeremy Farrar, Professor Padam Simkhada, Professor Ian Harper, and Professor Anthony Costello, whom we finally found. And thank you for coming. Tony, I've got your number, so I think it will be much easier to get in touch with you. We definitely would like to do more. And also, I would like to ask for more contributions for the colleagues who have been very busy engaging in organizing this event. Thank you, Jivanji, Padamji, Fraser. If you could help to synthesize, I think, and produce some small report to share for the wider public. But we have also got this the program live. That means it will be recorded, and anybody, irrespective of whether they have got the Facebook account or not, will be able to access what's in this program. And we'll also post this to our BNAC Nepal Study Days YouTube channel. And with this, I don't want to take more time. It has been fantastic in terms of timekeeping as well. Thank you so much for your active participation, for coming here, and we expect all your support in the coming days too. Thank you so much. Have a good day and stay safe wherever you are.
Thank you very much, sir. Thank you very much, Professor sir, Jivan sir, and all of you. Thank you very much.
Yeah,
for this wonderful program.
Thank you.
Thank you, Padam sir. Hope everyone is safe.
Thank you very much. Thank you. Yeah.
Thank you.
It's truly very, very inspiring, and I really, really look forward to working together in future. Yes.
Yeah.
It's a very, very. I'm very thankful. Yeah.
Thank you. And we'll be in touch with all the panelists going forward. I think a range of different.
Thank you, sir. Thank you very
much. Thank you very much. Thank you.
Bye now.
Bye. Bye.
Bye.
Goodbye. Thank you, everyone.
Thank you.
Hi, Ian. Thank you.
Bye. Bye. Thank you very much. Thank you, everyone.
Ian, sir. I can remember when I was in 2012 to Edinburgh.
Indeed.
Can you remember me? I was with Suzana Didi.
Of course, I remember you.
Yeah. Yeah, I was with Suzana Didi. Yes. Thank you.
Nice to see you. Okay.
At that time, I met Jivan sir also. Yeah. Yeah. Thank you.
Good to meet you. Yeah. Bye now.
Yeah.
Bye.
Bye.
Jivanji, shall I end this meeting, and we reconvene, or shall we stay here?
Or reconvene, or let people drop, I guess, and then we.
Yeah. We can have 5 minutes to reflect. Okay, thank you.
Yeah.
You can stop recording the meeting, Krishnaji, now.
Yes, definitely, and also live, isn't it? Okay.
Yeah, exactly. Yeah.